Well, Dana, I know that you are an amazing researcher and clinician, and your creation of pearls has absolutely enriched the field immeasurably. And you have shown us in this interview how you connect with patients in such a real and genuine and joyful way. I wanted to ask you, what did it feel like for you to be talking with her?
That's a great question. So it felt great to talk to Jocelyn, right? It felt great to be able to meet, it always feels good meeting families where they're at and being able to work towards building intentional relationships with the understanding that that conversation in the life of us as primary care physicians is one moment, and that we have the lifetime of D to build on that relationship. And so we are opening the door of a conversation with the hopes that it's going to continue over the child's life course. It also is challenging for me to watch that video because I recognize that I am a practicing primary care physician. I have 15 minutes with a patient.
Yes.
And we want to explain the purpose of the screen. We want to reflect on what it means for the mom and the child. We want to focus on strengths and protective factors, and it has to be done within the context of that 15-month visit, in which I also need to focus on her physical health, her development, and her vaccinations.
Yes.
And it's hard to watch because on the one hand, I think that it did show that you need to bring your authentic self to the situation.
Yes.
And at the same time, there were many places that the conversation could have deviated and we could have dived deeper.
Yes.
But I also know what it means that I have another patient in 5 minutes who probably is already roomed and waiting for me. And so I need to be present and also keep the pace of my morning going.
Yes. You said it very eloquently, Dana. And I mentioned before about being bilingual. I think that the dialogue between primary care physicians and mental health providers like myself in trying to create together an environment where the emotional needs of patients have a place, but where the physician also knows that her primary mission is as a physician within the constraints that the system places on her. That's a really important frame that we need to keep in mind. And what I was wondering is, do you think this is a young mom? In a way, I was thinking she could even be a patient of yours not too many years ago, right? She's young enough that she could still be in a pediatric clinic. I was wondering whether there was a longing for her, just thinking freely now, because now we have 15 minutes just to talk about this. I was wondering whether there was kind of a longing that you would care as much for her as you cared, and you really, really supported her. You were very empathic and affirming I was just thinking, did she want you to hear her pain also, not just her strengths?
What I can speak to is what I felt. And
Mhm,
I felt that there was so much hope and optimism that she had for her daughter. And I
mhm.
also felt that she had experienced pain.
Yeah.
And my job in that is that my role is to support the dyadic unit.
Mhm.
If I am not just the doctor for that child, I am the
Right.
doctor for that family in that moment, because the family has to be healthy in order for my patient to be healthy. And so I felt her desire to, one, to have me sort of recognize that she had been through hard times and that she doesn't want her daughter to experience that
Mhm,
too. That is what I felt in that moment.
mhm, mhm. And from me watching in, which is a different perspective, right?
Mhm.
I wonder to myself, would there be room to say to her something like, uh, it's very common. These things happen to so many people. What you are telling me, I hear from so many parents.
Mhm.
And they also tell me that they continue to feel the impact of what happened to them years later.
Mhm.
And I hope that you take as good care of yourself as you take of your daughter, because you are so important and because people continue to heal
I
when
love
they
that
do
addition.
things. Yeah,
Mhm. Mhm. I think that would have been a beautiful thing to add, and I'm gonna try that next time.
Dana,
Yeah.
thank you
Oh yeah.
very much. Really appreciate it. So you think it does fit in in your role, in your time constraints?
Yeah, I absolutely think that it fits because it is part of recognizing what this caregiver and child have experienced, and also the recognition that, our experiences are not a destiny, and
Mm.
that healing is lifelong, right? And there's time, and saying that I and uplifting that is really important.
Thank you so much, Dana. It's always such a privilege to talk with you. Thank you very much.
Thanks for the suggestion. Were there other comments or thoughts about what needs to happen in that, 3 to 5 minutes that we have to really discuss the anticipatory guidance around ACEs screening?
Hmm. What do you think?
So there are a couple of things that I know, right? And I know what needs to happen during that anticipatory guidance is, one, that we as clinicians are able to show up with our authentic selves. I think that
Yes.
patients recognize when we're harried or when we don't really have time for it. And so being able to show up with our wonder and our curiosity and our empathy is actually one of the most important things. I think that the second thing is to convey that experiences are not in people's head solely, right? Like these experiences are real and they get underneath our skin. And the third thing is that we can respond, right? And part of that response is being there and being with, right?
Yes.
Being with the child, being with the parents. And the other part of the response are resources that are within our network of care. So in
Mhm.
that moment, I think those are the three critical elements. And
Yes.
then there's so much anxiety on the part of clinicians around screening. And so then it's this knowing that we are enough, that we don't have to solve anything or everything within that visit, and that there will be more opportunities. And so I can call Jocelyn and say, I would like to make sure that we follow up in 2 weeks, in 4 weeks, in 6 weeks. We can follow up over telehealth, or I can actually have you come in. And we can follow up as many times and as long as we both feel mutually is necessary, and that I am your doctor, your kid's doctor, for until they grow up into their teenage, adolescent years through the beginning of adulthood, right? I'm here for you. And that's what we need to convey.
I think you conveyed all of those things so seamlessly, starting with the very clear and just supportive way in which you talked about adversity going under the skin. And I noticed that you said the hard things, which is another word, right? That is very, very easy, very user-friendly, very emotionally immediate. So you covered all those points in a way that she really responded to. She was very attuned, because you not only said it in words, you said it with your body language and your tone of voice as well. So it was all of a piece.
And I didn't use the word adversity. You're right, because I feel like that word adversity, just going back to that conversation, was in the beginning to explain the title of the screen.
Yes.
That word is on the paper, and so we can't
Yes.
just ignore it. But then
That's right.
once we no longer ignored it and we lifted it up, there was no need then to continue to use it, because
That's
what we
right.
are talking about are stressors, are hard things, are potential challenges.
That's right. That's right. Yes. So you really married the two languages into one cohesive message.
So we all can be bilingual.
Yes.
Yeah.
Thank you.
Yeah, thank you.